Watching TVC Breakfast. So as the emphasis on good and quality healthcare increases, the need to ensure that every patient that visits the hospital is well catered for and protected has become crucial. The World Patient Safety Day, which holds on the 17th of September annually, calls for global solidarity while enhancing the understanding of health workers on the need to avoid unsafe medication practices. This to ensure the safety of all patients. And for this year, the theme is medication safety, and particular focus is on the need for medication without harm. We have joining us now from our Abuja studio to discuss this salient issue, an occupational health and safety management consultant, Ehi Iden. It's good to have you join us on TVC Breakfast at this time. Talking about medication without harm, from your specialist point of view, describe to us, the glaring realities that demand the need for prompt attention.
This is a global concern. I mean, medication safety, and narrowing it down to what has happened in our country. We've had several incidents, and we live in a country where adverse effects reporting is very scarce. So we don't even get enough people reporting what they have had to go through medication error. But it's a big issue. And you take it from the hospital where we still use highly analog system, where you are aware how bad, illegible the doctor's handwriting could be. And that's one of the fastest examples that we can use. When you have such issues and the person who's supposed to dispense the drug assume he or she understands those writings and end up dispensing the drug. And this happens every day and people die in diverse numbers. Here we have no reporting. But what we are looking at today is trying to see how we can create more awareness, engage stakeholders on the ills that are inherent in medication safety, and see how we can protect people who come to our facilities. They come to our facilities because they need care, but when they end up suffering medication harm, I mean, that is not what we built to do. And one of the things we're looking at is how do we advocate on people using the three-step approach. And this three-step approach can really help reduce the preventable harm that comes from medication error. One of them is, do you know the medication? First, know your medication you're administering. Do you know the medication clearly? The second one is are you sure you have the right medication? Are you with the right person that really needs that medication? Are you administering the medication through the right route? Are you giving the medication in its correct dose? Then the last one is check. And if you are not sure that is the right medication, please consult a physician. So if we use this three-step approach, you find out that we can reduce medication harm to a very high proportion.
This issue of patient safety, focusing on medication without harm, is being commemorated for the fourth time in a row, just to go to show how important this matter is. But when it comes to the issue of education or creating awareness, how far have we come, seeing that we have had this day commemorated back to back in a row? Because sometimes you see some persons, especially in the rural areas, just walk into a store and want to buy a medication without some prescription, and it is sold to them.
Well, that has been a very big issue we have in Nigeria. But as for education, we have been at the forefront of advocacy and education, in line with patient safety. But outside all that, there's also the policy arm to this. What that means is that people are not supposed to walk into the pharmacy and just buy any medication that they want. And this has been one of the enabler of medication harm, because they just go into the pharmacy, buy whatever they have, and there's no law restricting them or guiding how you manage over-the-counter drug purchases. But in other countries that we have, you see there are strict laws that control how medications are assessed, but that we have not been able to do in Nigeria. It's one of the things that we're also looking at in this medication safety. As a matter of fact, Nigeria didn't really have a clear policy document to that. But I can say here that I'm a part of that technical committee. For the past 1 year, we've been working on a policy document, guidelines that speak to these concerns. That document would have been launched now, but we need the stakeholders' deliberation on that document before we launch. But we've gone far on this. So in the nearest future, or before next year or so, we are going to have this document launched before the end of the year or early next year, where people cannot just walk into the pharmacy and buy medication and just walk away. But outside the policy aspect of it, we are also educating people. I mean, the harm inherent in just walking into a pharmacy and buy medication. There's what you call look-alike and sound-alike medication or drugs. You may just walk into a pharmacy and say that the drug I took last time is pink in color or yellow in color. I want to buy the drugs. What do you use it for? I used it for arthritis. You know, when you go into such conversation, you may end up having drug that you are taking. It's not the right drug. It looks alike, it sounds alike, but you are just taking the wrong medication. And this could lead to terrible harm, death, and even disability. And we've had that happen in several scenarios. But this, you are very correct, and this is one of the key issues we are driving in Nigeria right now through the new document that is coming out on the National Patient Safety Policy.
All right, Mr. Iden, I mean, commendable documents, and we always have these kind of, fantastic ideas on papers, but issues around implementation is always a challenge. So I'm wondering how that would be achieved in terms of implementing those fantastic ideas. But I also want to squeeze in another question, and that has to do with the kind of people that we are as Nigerians. We are also very we're a traditional people. So where's the place of our herbs? Where's the place of roots? Where's the place of, for instance, here in the Southwest, Agbo, and issues around medication?
Firstly, I totally agree with you that in Nigeria, we have a lot of policies, a lot of guidelines, a lot of documents that are insufficiently enforced, or most of them are not even enforced. But from the body language of this current Federal Ministry of Health and the participation and the engagement I think we have received from both the tertiary and primary healthcare centers, I think we are on the good track, and the next phase that we'll be looking at is how to engage the private sector group, which of course contributes the largest healthcare participation in Nigeria. So I strongly believe that this will have the attention it deserves, because if it concerns you, you will give it attention. This is not like when we have to do policy for car repairs. No. Medication, once you get it wrong, somebody suffers for it, somebody dies for it. A family is traumatized for it because they lost loved one that would have been alive if not for the reason of wrong medication. Then come to your other question of herbs that we have here in Nigeria through the traditional orthodox drug availability in the country. This is a big issue. I think government also needs to give clear attention to. I don't know to what extent that this has been dealt with and to what extent policies have been made to regulate this. Yeah, those drugs actually, I think the law provides for those drugs, but to have that sector duly regulated so that not just all come and put concoctions together, and you see them hawking them on the street. You see some of them inside the commuting buses, and they're just selling, this can take care of this. It takes care of every part of every pain, everything you have in your body. This medication can take care of it. I think that's an area government also need to sit up and see how they can strengthen the regulations along those lines and the implementation of policies, if there are existing policies within those practices.
All right, I was just going to ask, but how has perhaps our environments contributed to Nigerians, resulting to self-medication, for instance, issues around poverty? Because, let's be frank, the bus driver or farmer or peasant farmer or trader would look at, if I go to a hospital to get proper medication, for instance, it may cost me more. So I prefer to just stop by the pharmacy, in fact, chemist, and just, ask for for drugs, which might be a bit cheaper and all of that. So in terms of our environment, how hostile our environment is, issues around poverty and all of that, has that also contributed to ensuring that issues around medication safety is highly, almost unachievable around here?
Thank you so much. When you have a country where health inequality exists and access to healthcare is almost not there, it becomes a big problem, and that's the fundamental root cause of this problem. Nigerians, I mean, let's take the NHIS or health insurance scheme as a clear example. Nigerians don't have health insurance scheme, and in Nigeria, health insurance scheme has been here since 1999. Less than 5% of Nigerian population have been enlisted in the health insurance scheme. So the bus driver on the road doesn't have health insurance, and this boils down to poverty, like you rightly mentioned. Not just poverty alone; it boils down to what you call informality of work. Nigeria as a country has over 80% informal workers. Informal workers are not documented, yet they are the drivers of Nigeria's economy. When informal workers are not documented, how do you provide them to give them health insurance? So what they do is that they work daily for what they have to use. So government doesn't even know that these people exist, but yet they exist, and they are employing so many people in the economy. So this is an issue that clearly needs to be addressed, and poverty is a big enabler of this as well. And not just that, we need an organized labor. If we have organized labor, I mean, payable labor, where you have 30 days wage check. I mean, that's formal working environment. You can say, okay, Mr. A and X have employed about 60 persons. And these 60 persons will need to be having deductions from their monthly earning to make up for what you call their health insurance premium. But somebody that's driving a bus on the street, how you to capture what he earns? This is a big problem, and I think one of the areas that's actually enabling this. It will be difficult to look at, but I think one of the ways to start is start profiling. I mean, organizing the unorganized sector, start profiling them, and see how we can help them access this benefit or social benefits that a country ought to be giving to its people. And so if these are available, the bus driver that is on the street, I mean, he has headache. I mean, you just walk to a pharmacy and say, I have headache, I need to take care of this headache. If he had health insurance, he would have gone to his chosen hospital and see a proper physician in an organized system where they will give him the right kind of drugs. And this is a big issue.
But looking at the situation in Nigeria, you made a crucial point earlier on health insurance policy, and even that is also reading with more challenges. We're having more and more sentiment circulating that if you can afford to go to a standard hospital or a regular hospital, the drugs they give you through your HMO scheme now may not be as good as what you would get in the pharmacy. So then people have even said they are told, in privacy in the hospitals, not to take the particular drug available in the hospitals and go out and get a stronger one. So what's the place of a better HMO policy in this argument for safe medication for all? Try to reconnect with Ehi Iden, but like I was saying, Veronica and Kelly, we have issue after issue. The health sector is indeed very crucial, but that has more or less prompted the attraction for advanced countries. We are seeing more and more of more Nigerians traveling abroad, seeking better healthcare, and that happens to be the one of the that happens to be the driving force.
What about is the medical tourism.
Absolutely,
yeah. And medical tourism.
But then, like Kelly said,
medical personnel moving out of the country as well.
So it's even a double problem, yes, because the medical practitioner wants to travel, the average Nigerians too wants to travel.
Who should know what you have to give the right card, to administer the right medication, is living.
And mind you, they know what they should do, but
they know what they should do because they are the experts.
Right.
They are the ones living. And then you are leaving the country with what? Those who do not have that level of expertise to go. So the patient or Nigerians are in a dire situation. So that is what it is now. So except, government has to address it on the one hand, but there's also the aspect of the patient asking questions. If you are being given a drug, if someone is administering a drug or prescribing a drug, ask questions. What is this? What is this medication about? And ask all sorts of questions.
Check dates, expiry dates,
check the expiry date, manufacturing date, look at the side effects.
There's lacks on the people too.
They have to do that because although sometimes the medical personnel would not want to give you detailed information. That's one aspect I would have loved to ask Ehi Iden. How does this come into the mix? Because some persons will now go out, perhaps they have a recurring situation, they go and buy that medication.
Because they know that's what they used the last time
earlier, you know, and it helped earlier. So there's a lot of issues that has to be addressed.
I think the COVID-19 pandemic exposed us even the more, exposed our healthcare system even the more in 2019. Issues around medical tourism and the fact that our healthcare systems have always been in a sorry state. But even as it stands, even right now, even after the pandemic, our healthcare systems, it still appears that are still in a sorry state. And I think we need to work on it. As Veronica said, Nigerians too, we have to take responsibility. I mean, those medications.
Ask questions.
Ask questions. Read.
It's a collective. It's a collective responsibility, not just on government, but the people. Like I think that's what we need to also talk about. But time is not our friend. I would say a big thank you, Ehi Iden. If you can hear us, thank you very much for speaking with us on TVC Breakfast.